I want to talk about sickle cell disease, what some other people call sickle cell anemia. So sickle cell disease is a genetic disease, which means in simple terms, it is spread from parents onto the children. It is an autosomal recessive disease, which means you need both genes, basically one from the father and one from the mother, so you can end up with a child that has sickle cell disease. It all comes about because of a mutation in the DNA of red blood cells. So you find that these red blood cells end up being different in shape. Your normal red blood cell is supposed to be nicely round. So this disease causes red blood cells to end up having kind of a C shape, where the name comes from, sickle cell disease. Other people call it sickle cell anemia. So basically, all the problems of sickle cell disease start from that red blood cell being slightly different in shape. If you're asking about how sickle cell disease presents, people usually have myths out there. We used to have myths of these children do not see their first birthday or they do not see their fifth birthday. All those are not currently correct, because over time we have gotten new science, we've gotten new evidence, and we can comfortably take care of these children of sickle cell disease. As a parent, the things that you want to look out for in your child: you have a child that is always sickly, you have a child who's complaining of pain. They usually complain of pain in the tiny digits, the hands and the feet when they're still young. They can have pain in an entire leg or arm, anywhere else. You have a child who is seemingly looking pale and they don't look like they have enough blood in the body. You have a child whose eyes are seemingly yellowish, so you see that yellow color instead of the nice white eye. You have a child who is always in hospital and for some reason they tell you the blood levels are low, or you're going to transfuse, or please come back and we check the blood levels again. All those are some of the signs that we see in children that have sickle cell disease, especially when they are still young. As they grow older and the disease is confirmed, then usually the overt signs that people fear most start coming out. Oh, my child has a different shape of the head. My child has pains that never go away. My child has very bad chest infections. We end up on oxygen and antibiotics. God forbid, my child, has a stroke. One side is not functioning. All those are some of the presentations that we see with sickle cell disease. Unfortunately, because sickle cell is a genetic disease, we do not have much to do about it in case it sets in, okay? Its treatment is basically very, very supportive as much as possible. We as pediatricians, we disregard the myth that these children should be hidden away in the houses. These children should not be taken care of. They are still children and they deserve our undivided attention and love 100%. They actually require a little bit extra, okay? So just like any other child, they need their basic needs. They need food, they need water, they need to be kept in a good environment, they need to be protected from all these communicable diseases. But on top of that, they have these visits to us, the pediatricians, every now and then, so that we look at those other tiny details of their health. So I'm encouraging all parents out there, if you have a child and you're thinking that they might be having sickle cell disease or they have some of the symptoms I talked about, please walk into any hospital and see a pediatrician. They will sort you out. If you end up having a child and you think the care that you're getting is not up to standard, please seek help, okay? There is help out there for these children with sickle cell disease. Many people, we are now turning to disease-modifying drugs, and I think our wonder drug right now is hydroxyurea. Please note, it is not a cure for sickle cell anemia. It is not a cure for sickle cell disease, but it is a disease-modifying drug that it makes life a lot more smoother, reduces your admissions to hospital, reduces your chances of getting those very bad conditions and complications that we fear most in sickle cell disease. Is there a cure for sickle cell disease? Yes, there is, but it is not something that, any normal Ugandan or country person can walk into, because it is quite pricey. It comes a lot with other complications, and usually those patients are treated in other countries. But yes, people have done stem cell therapies, people have done gene therapies, and those are actually written down as potential cures for sickle cell anemia. Lastly, like we talk about HIV testing for people that are walking into relationships, for young couples out there that are thinking about starting a family, please remember to test yourself for sickle cell disease. Like I said in the beginning, it takes a mother with a gene of sickle cell disease and also a father with a gene of sickle cell disease, and those two will give that gene to a child, right? So with a sickle cell trait, the people that are called carriers, another parent of a sickle cell trait, another carrier, have a 25% chance of giving birth to a child with sickle cell disease. And that chance happens on every pregnancy, So as pediatricians, we want couples to walk into that knowing what the chances are that when we end up with a child of sickle cell disease, we do not have two problems of having a child and a family that is broken up because they didn't have this information with them. I hope that is enough for now about sickle cell anemia. Once again, my name is Michael Stephen, and I'm a pediatrician. Thank you so much.